folks. Can you hear me? This is Melissa.
We sure can.
Okay, great. I'm so sorry about the technical difficulties. Are you able to share the screen, Matt?
I am. Can you see it? I should have the PowerPoint up now.
I can't see anything because my BlueJeans is a disaster, but I am able to speak to you all, and I am able to tell you when to advance the slides. So I think we should be all right as long as someone can inform me as what goes on in the chat. And I really apologize to all of you for the problems.
No worries, got you covered. So we're on your title slide right now.
Okay, great. So hi everyone. I'm just going to go ahead and get started. Thank you all for joining us. This is the first of our series of webinar or Take 20s on all things Hill Day. Today we are going to go over the Medicare Oral Health Coverage Act and the background behind it and what you can talk about and what questions to expect and that kind of thing. So Matt, you can go to the next slide. This is just a reminder of what our three asks are. That we are asking Congress to add oral health coverage to be included under Medicare Part B services, and that's what we're going to focus on today. And what you will get in our next three webinars is one on, the next one will actually be on the CDC Oral Health Funding for States ask, that Congress should appropriate additional money to ensure that every state gets a grant from the CDC for an oral health program. The following week, it will be on pregnant women's Medicaid coverage and asking Congress to address the link between maternal health and oral health by making pregnant women's coverage a mandatory service in Medicaid. And the final webinar in this series will be on tips and tricks for a successful meeting with a member of Congress and or their staff. What to expect. So that's what we're doing in this series. As I said, I'm going to be focusing on Medicare coverage today, so we can go to the next slide, which just says that in big, bold words, so you can start really getting that clear in your mind that what we're focusing on in Medicare oral health coverage is asking Congress to specifically add oral health in Medicare Part B's covered services. On the next slide, you'll see what exactly we're asking for. What does that mean that we're asking Congress to do? So what we're asking a member of Congress to do when we go to their office and we're talking either to them or their staff, we're asking them to consider co-sponsoring or introducing a companion bill to some existing bills that would actually already address this issue. So those are bills that would provide comprehensive oral health coverage in Medicare. And they may also do some other things. They may also include vision and hearing coverage because those are also excluded from Medicare. So some members of Congress like to look at all three of those issues together. They may also include Medicaid funding for some of these services. Folks within Open, all that have been working on this issue feel that all of these bills that are out there do a good job of addressing oral health coverage, and so if there's additional add-ons, that's fine with us. In some cases, we may even think that's a benefit. But the key is that it adds this comprehensive coverage to Medicare Part B. And so if you go to the next slide, you'll see what some of these existing pieces of legislation are. And some of them we're going to focus on three of them. We're going to focus on the bottom three. So HR 1393, that's Representative Doggett's bill, the Dental, Vision, and Hearing Care under the Medicare Program Act. And this bill, as is fairly evident from its name, would add all three of those services to Medicare. This bill has been introduced in Congress previously under Representative Levin, and it's one that's getting some significant attention in the House right now. There may even be a hearing on this bill sometime around while we are in DC, so that would be exciting. So it's one that we're certainly going to be asking people to pay attention to while we're up there. And the other thing is you'll notice there isn't a Senate version of that particular bill, so that's one in which you could ask a member of Congress to add a companion to that bill and or join as a co-sponsor if they're in the House. The next on that list of bills we would focus on is the Medicare Dental Benefit Act of 2019. You'll see there that is S22 and HR 2951. And those were respectively introduced by Senator Cardin and Representative Berrigan, and those are ones in which we were really looking for additional co-sponsors and support. That one focuses just on Medicare dental, and it's a bill that a number of open members were involved in crafting. And so it's something that, I think we would be particularly interested in seeing move forward, because it would just be sort of a clean focus on oral health, so the other issues are certainly important as well. And then finally, there's S1423, which is Senator Casey's bill, Medicare and Medicaid Dental Vision and Hearing Benefit Act of 2019. That's another one that does look at all three issues, and this one includes a funding bump for Medicaid in addition to adding those covered services to Medicare. So, as I should have said at the beginning, Medicare does not currently cover oral health services, as most of you probably know. And so we are looking at these bills as different ways that could be addressed. This first one at the top of the list, Representative Roybal Allard's bill, is one that someone, when you're talking to them, could potentially bring up because it's out there as well. Seniors Have Eyes, Ears, and Teeth Act. However, it doesn't actually offer comprehensive coverage of these things. It just means that Medicare would no longer exclude them, which is a fine step, but not something that we're really going to focus on, since what we would really like to see is actually those services get covered. So I'm just mentioning that one in the list so that you know all the things that are out there that are on this issue. So next slide, you'll see kind of distilled down the fact that we would focus on those three pieces of legislation. We would be asking a member of Congress if we want them to add oral health coverage to be included under Medicare Part B services, that we would want them to consider co-sponsoring or including a companion to these three pieces of legislation, because those are where there's already some energy, already some attention, and that's going to be our best shot at moving these things forward in the short term. So that's making that kind of big ask something that'll be really specific and real for your member of Congress. Now, what I'm going to talk to next is what background materials and information would be helpful to kind of help you make the case that they should do this. So on the next slide, you'll see there's sort of four categories of things that you'll want to think about before you get there. First, you're going to want some background information on your member of Congress, kind of what committees are they on, what are they interested in. This is something we've talked about before. You'll want data on how this affects your state or your community or your district. You'll want to think about whether there are stories from your work that you could share that talk about how, people would benefit from adding this coverage that in there and then finally, something that I think is helpful to bring up is that this is something that's really popular with the general public. And so now I'm going to go through a couple of things to kind of help you think through each of those pieces a little bit more. First, on the next slide, you'll see the key committees, the committees in Congress that have the most influence over Congress doing something for Medicare oral health. In the House, those are the Energy and Commerce Committee and the Ways and Means Committee. If you find out your member of Congress is on one of those two committees, you'll want to really focus in on this particular ask. That's something they may be able to do a little bit more about. And then similarly on the Senate side, the Senate Finance Committee and the Aging Committee are ones that you may want to put a particular energy into this ask if you find out you have members of Congress that are on those two committees. On the next slide, in terms of data, this is something I can speak to at the national level. I can tell you that 60 million seniors and people with disabilities rely on Medicare for their oral health coverage. I can tell you that 27% of older adults have lost all of their teeth to oral disease. I can tell you that 3 out of 5 older adults have not seen a dentist in over a year. But what's really going to matter to a member of Congress is how this affects their state or their community. And so if you have your own data that you like that talks about, how older adults and people with disabilities are affected by oral health or by not having oral health coverage, I really encourage you to pull those out and to use them. But if you don't, luckily, we do have some state-by-state fact sheets that are linked here and also in the resources that will help you identify some of those key stats as to how many people would benefit and sort of what their oral health status is. So you'll be able to get those, and we will provide them in the packet of materials you get on the Hill Day with a number of other helpful things. On the next slide, you'll see the fact that this is particularly popular. Adding oral health coverage to Medicare is something that a large majority of people support, of likely voter support, that of people of all different geographies, of all different ages, of all different backgrounds, and on both parties, the majority of people support. So this is something that you will be getting additional information about, some infographics you can use that you may want to pull into your conversation, but it's just something to keep in mind that not only is this something that would help a lot of people in members of Congress' districts and states, but it's also something that their constituents would be really excited about. So with those 4 pieces of information in your mind when you get to the conversation, you will be very, very well prepared to talk about this issue. And when you're having that conversation, there might be some other questions that come up. So on the next slide, I'll go into what else might come up in your conversation. One question that we often get is, how much will this cost? That's something that we don't have a solid answer to, and that's okay. There have been some studies looking at what this could potentially cost. One of those is available in a white paper that Oral Health America and a lot of other folks, including Families USA, helped with, costed out what one particular model of a dental benefit could look like. But we don't know exactly what all of these bills would cost. I think some of these members of Congress that have introduced bills are trying to figure this out. But I think the key thing to remind folks of when they ask is that, all this other data and stories and things like that you've already mentioned to them, telling them that it's something that's being worked on, and also reminding them that there are, savings in healthcare when there is oral health care provided. That, when you improve overall health, people may need fewer other healthcare services, and they're less likely to be going to the ER for oral health. So I think that's one thing you may get, that it's okay that we don't have a solid answer. Other things that might come up are the fact that Medicare dental is coming up in other policies in Congress, which I'll talk about in a second. Another thing that might come up are the universal coverage discussions, and then finally the medically necessary administrative efforts. If you go to the next slide, I'll start getting into those. These are, big health trends that are happening that are relevant. The first is that the biggest, hottest topic in Congress right now is drug pricing and controlling or lowering drug prices. And interestingly, one of the big packages led by Nancy Pelosi to do this has a line in it offering that savings from that potential policy would maybe be used to pay for something like Medicare dental, vision, and hearing. It's not, a guarantee. It's not likely to move forward as is, but that's something that could come up and something that we should encourage. The other thing to think about is that something that's really top of mind for members of Congress, especially if they're up for re-election, are these big universal coverage discussions that are happening around Medicare for all and that kind of thing. Whether they're for it or against it, I think it's important to remember that that might be part of what's informing their thinking, and that if they're for universal coverage, oral health should definitely be a part of whatever universal coverage plan is proposed by them or that they would support. And if they're against universal coverage, this is something that is an incremental step. Adding dental coverage to Medicare is an incremental step on improving the health system and improving Medicare that doesn't go all the way to Medicare for all. So that's just another thing to keep in mind. And then on the next slide, finally, this incremental administrative action I mentioned called medically necessary dental coverage, I very much put in quotation marks because, a lot of dental care is medically necessary and that's not encompassed here. But there is an effort underway that would require an administrative ruling to give a very limited scope of dental coverage be covered under Medicare. This is something that's been going on for a while. It's something we've engaged a lot of you on, and it's something that may come up with members of Congress. And certainly we support this, and we think it should move forward as is, and it doesn't need legislation to happen. Congress doesn't need to pass a law to do this, and it would help a lot of people in a very specific way. But we do want to make sure that people understand that this is not going to address all oral health needs in Medicare, and that it is just a very good first step. So with that, I realize I've covered way too much in 17 minutes. So I want to turn it over to you all with questions, and certainly give you time to process some of this, and always feel free to come back later with it. So it's *4 to unmute, and if there's anything in the chat, I would appreciate it if someone could read it for me.
Yeah, I'm monitoring the chat for you, Melissa. Nothing yet. Stay tuned.
Thank you.
Yep.
All right, well, this may be an easy crowd. I will say that there's additional resources linked in the slides for you all if you want to get some additional background on this issue before your meeting. And I'm happy to answer any questions you have offline as things come up, as you're thinking through what stories you might want to tell as you're looking for data. Please feel free to reach out, and we can, come at this issue as informed and as powerfully as possible. And if there are still no questions, then we'll see you next week for our next webinar, which will be focusing in on the ask around CDC funding for oral health.
Just one quick, a question did come in the chat, Melissa,
Right.
which reads, should we remind people that I don't know is a good answer?
Sure, yes. I don't know is a totally fine answer. Never feel like you have to make up anything to satisfy what they're asking, and always feel free to reach out to me or to your other national partners in follow-up. You can always say, I don't know, and that's fine, and you can also say, I don't know, but I can ask someone and we'll get back to you, and we're always more than happy to assist you with that. But definitely, I think, knowing what you don't know is acceptable and expected, and you're not going to be an expert in all three of these issues when you get there. So that's just human and fine, and we will support you in any way that we can. But the point is telling our story and reminding them about these issues so that they know where to follow up, get more information.
Okay, great. And we also have one other anonymous question, which it's a person that would like to participate in the Hill Day activities, but has been told by their supervisor they're not allowed to, and they're just curious. Do you have any recommendations about how to navigate a situation like that?
That's a really good question, and I think it does somewhat depend on exactly what your situation is. So if you're comfortable with following up with any one of with me or with Matt offline, and we could have a conversation that builds that out a little bit more, just sort of what the restrictions might be, we could help you navigate it. But unfortunately, it's sort of hard to know what exactly the restrictions are. We'd be happy to have a conversation about what advocacy versus lobbying is, what state employees are and are not allowed to do, or other folks that receive government funding are or are not allowed to do. 501c3s certainly are allowed to lobby most of the time, while you do have to record that time. And so there's a lot of different rules out there, and there's a lot of different preferences, but it's something that we could certainly talk through, help you navigate whatever your sort of specific situation is. And I apologize, I don't have a more direct or concise answer.
No, it's a tough question. I think it makes perfect sense. Yeah, I agree. Like, we can empower you with all the information that's available about what is able to be done and not. And then finally, we just have a question. Are you sending us all these materials in advance? I assume that means the slides and the recording of today's call, which will be posted on Socius. And we will also be supplying people with materials before they actually go on Hill Day directly. You'll have like a one-pager that has a write-up of the asks. Do you want to detail any more about that, Melissa?
Oh, sure. Yes, you guys will be getting all kinds of goodies ahead of time to help you prepare. You will get a one-pager with all of these asks. You'll get a template script you can use as directly or not as you want to help you talk through all of these things. You'll be getting background materials on each of the asks in case you need a little bit more information and that you're welcome to share with your member of Congress and leave with them. And you'll also get other sort of supporting materials that will help you just feel more comfortable with your visit in terms of, a schedule and your when your appointments are and where to be when, and possibly a couple of other things. So you'll be getting plenty of materials. They'll come to you ahead of time. You'll get digital copies before you get to nationals, and then you will also be getting the paper copies on Wednesday before we head down to DC on Thursday.
The chat says thank you for that response.
You're very welcome.
I think that's it, Melissa. So thanks for this presentation today and for putting this series together to give people the tools they need to have a successful Hill Day. We're really looking forward to it. We certainly appreciate your leadership on the issue, and it's going to be an excellent event. Applause from the chat.
Thank you all. All right, well, have a great day, everyone.
You too.